जलश्री मैम आपका म्यूट है।
Hello everyone, I Dr. Jalashri Ranjne welcomes you in the 11-day free webinar series organized by Aisha in association with Samragee Homoeopathic Clinic. Today is a fifth day and it's a fortunate to have Dr. Amruta Hede ma'am with us today. Heartily welcome ma'am and also welcome to all the participants for today's section. Thank you.
Hello guys, good evening one and all. To tell you about the Samragee Homoeopathy Clinic.
What happened, ma'am? Continue. You can continue, ma'am.
One second, sir. Homeopathy is based on the theory of teaching like cures like. It claims to stimulate healing responses to diseases by applying substances that mimic the symptoms of those diseases in healthy people. To provide the treatment of wonderful system, Dr. Vibha Mevada, who is a budding and enthusiastic homeopath, has started Samragee Homoeopathic Clinic on 4th Feb 2018 in Indore, Maharashtra, India. Dr. Vibha Mevada did BHMS from Nasik University in 2015 and did CCH Certified Course in Advanced Homeopathy and MCH Master Course in Advanced Homeopathy, which are short-term PG course from the most prestigious institute, the Other Song International Institute of Advanced Homeopathy, Mumbai in 2016. Ma'am is a certified yoga instructor by Yoga Certificate Board, Ministry of Ayush, Government of India. Dr. Vibha Mevada has been trained under renowned homeopaths like Dr. Rajan sir, Dr. Dinesh Chauhan sir, Dr. Gaurav Gaikwad sir, and took many national and international webinars, and her articles and cases are published in many prestigious platforms of homeopathy, National Journal of Homeopathy, homeopathy.com, etc. Following the footsteps of father of homeopathy, Dr. Hanuman Ray is also being treated at Samragee Homeopathic Clinic. The mission of Samragee Homeopathic Clinic is to serve people. Several health camps, medical camps, free yoga, and aerobics workshops has been conducted at the clinic as a benefaction of people. There is no denying the talk that they do treat here the best to assure the satisfying rhythm, leading to a lifeline to better health. Thank you.
Before bringing up Dr. Vibha Mevada, ma'am, I would like to bring up Dr. Rameswar Vishwakarma, sir, on stage to say the welcome speech. Dr. Ram, over to you. Please turn on your video if possible.
Good evening, everyone. I, Dr. Ram Ishwar Vishwakarma, welcome to all of you in the 11th free webinar series organized by the ISA in association with Samragee Homoeopathic Clinic. Today is our 5th day, and it's our fortunate to have Dr. Amruta Hede ma'am with us today. Heartily welcome, ma'am, and also welcome to all the participants for today's session. It's a very knowledgeful webinar, so get to enjoy all of viewers. Thank you all.
Okay, so good evening, all of you. I just want to say a few words about Aisha first. So, Aisha is All India Homeopathic Student and the Youth Association is one of the largest association of homeopathic students and youth of our country. This association plans a great role in upliftment of youth and young homeopaths to take the responsibility on their shoulders. This is the association of the student for the student and by the students only. The aim of this association is to work selflessly for upliftment of allying humanity. We believe on the phrase united we stand and divided we fall. So this is the right time for all the young pets across the country to come together and work for the betterment of the nation, to make India the most powerful nation by devoting their time and work in right direction for the nation. We organize free health camps, free seminars, webinars, blood donation camps, and we have also developed our own library which we give to the students who are not able to afford books. We also promote scientific and research oriented mind of the youth by publishing their articles and presentation or any kind of literature which is of the value for the homeopathic fraternity and for the humanity in our magazine called Homoeopathy. We believe in the importance of time, so our motto is to awake, arise, and work before it's too late. Because AIM says, I am always in motion. Our thoughts are our actions, so we believe in having a positive mindset to believe ourselves to rise above the mass for achieving a higher purpose of our existence. So this is about our about the Aisha. Now it's time to introduce our today's speaker, Dr. Amruta Hede, madam. So Amruta is a consulting homeopath and academic faculty at the Other Song International Academy of Advanced Homeopathy, Mumbai. Madam awarded BHMS degree from the prestigious Goa University and had the gold medal in the subject of physiology at university examination. Ma'am is a consulting patient at the Other Song with Dr. Rajan Shankaran and also as a part of the Charitable Clinic at the Other Song. She is practicing since last 9 years and as a homeopathic consultant and 6 years of homeopathic practice at the Other Song Clinic and academic of advanced homeopathy. She is consulting women's health screening as a part of corporate health clinic at SDIPEC company. Teaching faculty at the Other Song International Academy since last 2013. Ma'am conducting music proving regularly at the Other Song, and she is also take part of the editing team of the books Just You See and Just You Think by Dr. Sunirmal Sarkar. She is conducting regularly patient awareness seminars at the Other Song Clinic. Ma'am providing personal mentoring for Indians and international students also. She is trained to handle cancer cases with Dr. Sujit Chatterjee sir and Dr. Sunirmal Sarkar sir. She trained to handle pediatric cases with Dr. Paresh Vasani for 4 years. Trained to handle gynecological cases with Dr. Rashmi Jasin for 6 years and trained to handle deep pathological cases with Dr. Gajanan Dhanekar and Ashok Borkar, along with mentoring for international students. And she is conducting research in the field of music proving. So this is in short about the professional bio of ma'am. But as I'm a student of ma'am and I know her personally, with the best doctor and a teacher, she is also a kind-hearted person. I thought when I was in the Other Song for doing my master's course, whenever madam took some case of any patient or suggesting any medicine in front of our master, I don't think anyone can refuse that the patient is other patient have other medicine or prescribed other medicine was suggested by madam. So she is a very, I can say, a very sharp and a very talented doctor. What I saw in around me. So thank you so much, ma'am. And she is always ready to help me in my practice also. And if I got any problem in any topic, she is always ready to help me. So thank you so much, ma'am. Without wasting time, I just hand you over to you now to start the session. Thank you for being with us today.
Sorry to say, but there is some network issue with our speaker, ma'am. So please, we have to wait for a few minutes. A few minutes, I think so. Please hold on for a few minutes, and until then, let me just say you myself, Medico Orko Mukherjee. I am from Aisha West Bengal branch, and I am also a second year student, BHMS student from Bardhaman Homeopathic Medical College and Hospital. So basically, here I came up as before ma'am comes on. If you want to get a participation certificate, I know it is time, it's not the time to say right now, but I need to plug it on. If you want e-participation certificate for our series which is going on, so please do make sure to uh, fill the form given in description. Now we have been done with the form fill up, and since we have daily the certificates from where from the website it is being issued, so please make sure to fill the form as early as possible in order to make it to the 100. So if you want to get the e-participation certificate, so that's all. And one more thing, if you want to see more like this, do make sure to subscribe now and press the notification bell, and also do make sure to follow us on Instagram and like us on Facebook. So let's wait for ma'am, and let's take 1 or 2 minutes for now from now. Hello ma'am, can you hear me? Hello, Amruta ma'am, can you hear me? You are being muted. Please unmute yourself, ma'am. Hello, Amruta ma'am, can you hear me? I think problem issues with your network, ma'am. Viewers, please hold on until ma'am gets connected with us. Ma'am, unmute yourself, ma'am. Ma'am, you have to unmute yourself. You are being muted, ma'am, for some reason.
Hello?
Yes, ma'am.
Can
Yes,
you
ma'am.
hear?
Now I can hear
Can
you.
you can you
Now I can
you
hear
can
you.
hear me, right? What is Vibha's
Yes, ma'am.
email ID?
Why, ma'am?
I want to send her the PPT if you can.
Okay.
Okay.
If she,
Okay. Okay.
can
Ma'am,
you, Vibha,
sending
if I send
you
you
on
PPT, will you be able to?
Arco. Can we do like that?
Yes, it's possible, but you have to share the screen,
So
Viva, ma'am.
email ID बोल दो please.
Ma'am, sending you
विभा
WhatsApp. Sending you on
email ID.
WhatsApp.
अरे वाप इसमें बैक नहीं जा सकते फोन में प्लीज.
Just tell Mevada Vibha, MEVADA.
है मेरे पास. ओके.
Yeah.
आई एम जस्ट
Okay.
सेंडिंग यू. ट्राई करो अगर हो रहा है तो ठीक है.
Sure. Arco, I have to download the PPTs
Okay, I
then.
think let us start.
Yes.
Let's try without PPT today. How about that?
Have you sent, ma'am?
One more. There's a lot of network issue from ma'am's side.
Yeah.
Same as usual. I'm left and came back.
हो तुमचा घेतलाय नेट मी आता. नाही होत
Ma'am,
आहे.
have you sent?
एक मिनिट
Ma'am,
हा
have you
मला.
sent Viva, ma'am?
No, still I doesn't got me.
नहीं नहीं रहने दो. कैन वी डू विदाउट पीपीटी?
If so, it can be, ma'am.
No
But it
problem. No.
was best with PPT. But when there is problem with network, so you can do it without PPT, ma'am.
Yeah, ma'am. No problem. We can do it without.
But ma'am, your network issues is giving a lot of trouble, ma'am. Too much of network issues.
Net is running slow.
Sorry, speakers, for the delay. I know it's not happen usually, but please do cooperate with us. As for the first time, we are facing such problem. So please do make sure to cooperate with us. Until then, you can go and follow us on our Instagram, if so. Hello, hello, ma'am. Can you hear? Can you hear us, ma'am? Ma'am, can you hear us? Oh my God, too much of trouble. Hello, Amruta ma'am. Can you hear us?
Yeah, Orko, we are going without.
Okay, but we are going without PPT, but still the internet, there is a lot of internet issue, right?
Okay, she just called me. She's coming.
Okay, let's wait then.
Yeah.
To all our viewers, you can see on the screen what is showing. So please do make sure to wait and do cooperate with us. It will be helpful. We get you back as soon as our speaker comes in. Until then, please do cooperate and stay with us. If you want to ask anything about Aisha or about related this related topic, you can ask on live chat. So now I am leaving and let's wait for ma'am.
Hello,
Yes, ma'am. We can hear you.
hello, hello.
Yes, ma'am. You are audible, but your
Am I
network is
audible?
very slow. Yes, ma'am. But your network is
Uh,
too slow, ma'am.
तो आवाज टूट के आ रही है?
ना मैम, आवाज ठीक ठाक आ रहा है, बट बीच में अटक जा रहा था। अभी क्लियर है मैम।
अभी ठीक है? हाँ? We'll start. शुरू करते हैं क्या?
यस मैम। यस मैम।
Okay.
Ma'am, you just send the PPT and we will give the link on the description
मेरे
after
को
the
I'm
video ends.
scared to connect the this thing only thinking again if I share phone चला
No, ma'am, you
जाएगा.
can share. There was no problem with there. I think the network issues made the problem worse. Or else you can just send the PPT to Viva ma'am or anyone else in our Aisha team. You know, in your known. So you can send them and we will share it on a document format in our description so that the viewers get an idea about that.
हाँ वो सब ठीक है but यहाँ पे my problem is net.
Yes, ma'am.
So I'm scared if I use the same network connection for two apparatus, इधर phone चला जाएगा या laptop चला जाएगा.
हाँ मैम, एक बार ट्राई करके ही देखिए। जब अभी नेटवर्क जब
ठीक है.
अच्छा आ रहा है तो मैम अभी ट्राई करके ही देखिए मैम।
Done. Forward. विभा ने क्या बोला था अपना डॉक्टर?
क्या मैम?
विभा मेवाड़ा क्या बोला था उसने उसका आईडी?
मेवाड़ा विभा। मैम आप, मैं ले रहा हूँ स्क्रीन पे।
मेवाड़ा.
विभा मैम आप बोल दीजिए।
मेवाड़ा विभा 2
बोला. अभी देखो सेंड.
Okay. We share it now. You start without PPT.
My screen froze यार लैपटॉप का. This is one interesting day today.
But you start with without PPT.
Okay.
Ma'am, you start with the start without PPT, ma'am. I hope that will be best for now.
Okay.
And Viva ma'am, if you have received it,
Yes.
please try to share it on screen if possible, Viva ma'am.
आवाज बराबर आ रहा है लेकिन that is most important.
हाँ मैम, आवाज बराबर आ रहा है मैम।
Okay, done. Okay. Fine. Okay, I think let us start.
Yes, ma'am.
I'm very sorry for all the delays that are happening. But anyways, I think we will try our level best to see that I convey what I have to convey and it reaches you. Otherwise, I also wish to maybe record it again and we'll do something about it. But those who are there, let us start. So thanks Vibha for inviting me. And Vibha is a very dear student. I hope everything goes fine after this. Okay. If there's any problem with the voice, somebody please interrupt me. Okay.
Okay, ma'am. We'll make sure.
Okay, Vibha, should I start?
Answer some. Yes, ma'am. Please start. Yeah.
Fine. So basically, what I wanted to do is that tell you all is I didn't want to show the common cases which we all see of the remedies, but I wanted you to know that what is the most important thing when you're dealing with gynecological cases, because these things could be quite challenging. What is most interesting and important in gynae cases, we are missing the PPT today, so I expect your double attention here. is the history. If we go in detail of the history and some points, if we uh, go deeper without fail, then most likely we'll get some very interesting ailment from factors. Some specific history which you have to go in any gynecological case. One of them is the rule that at different phases in the life, whenever there was a strong hormonal change, to understand whether there was any problem at that time. For example, so in the history, if you get a female who's now in the 40s, but if the problem started when she was younger, then all the problems started since puberty. So puberty, the pregnancy, the climate traits, these are the most common things, which we have to consider. So in the case taking, even though the patient won't tell you, yes, since my puberty I have this problem, you have to probe and understand whether it was any of these changes when the hormonal changes happened in the person that affected the person. So something like puberty, the pregnancy, the menopause. Okay. Because again, once a patient is in old age around 70 and they have a lot of complaint, we forget to understand the complaint started maybe after menopause. So conscious questioning is very important here. The second thing that we have to understand in the history is if there's any history of abortion and how was the lactation at that time. Okay. If there was history of any suppressions, now this is very interesting, we have to understand if there was history of any leukorrhea that was treated with any kind of allopathic pills or any kind of local applications. This becomes very interesting history because we have so many remedies based on this history we could prescribe. So always understand if there was history of any suppression in the past in the form of suppressed leukorrhea. Or next point is if there is history of any operations or some kind of procedures that were done. For example, it could be removal of one cyst maybe or curettage, because sometimes the patient will forget to tell you maybe in the past if there was any curettage that was done, curating, if there was a hyperplasia of the uterus. So these things are also important. Some any kind of gynecological procedure that was done, we have to understand, because if the complaints start after a curettage, maybe remedy like belly spur comes into picture, that is ailment from injury to the internal part. So some very small things like this, which we will if we don't probe, we might miss this information. So I'm telling you, this becomes very interesting. So the phases of the life, the history of any abortions, or the history of lactation, whether there was enough milk or there was completely no milk, right? That history is important. Suppressions, for example, leukorrhea suppression, history of any operations in the past, and history of any procedures. In recent times, when you get cases, you will see most of them have visited a lot of gynecologists and they have come to you, right? So history of taking a lot of hormonal tablets and pills which they come up with, lot of estrogen, lot of progesterone is already taken when they come to you. This history is very important because your prescriptions could be based on these prescriptions, which are the allopathic medicines which are given, if there is any side effect of any particular hormone that was given in the past. Okay. Next is the sexual history, which is also important in gynecological cases, whether there was any injury to the part because of excessive sexual indulgence. So the sexual history has to be probed. Uh, Complaints before, during, and after menses, which are very, very important. Trying to understand the characteristic. If there was any breast heaviness, if there is any pimple, is there any constipation, is there any diarrhea, are there any headaches before menses? So all these things, complaints before, during, and after menses are very interesting. If a patient is amenorrheic, there is no menses, then what are the complaints, problems that happen to them when they are not menstruating? That is very peculiar because it could vary from patient to patient. So somebody gets leukorrhea instead of menses, somebody gets headache instead of menses, somebody gets bloating when there is no menses. So this history also becomes very interesting. So whenever there's amenorrhea, what are the symptoms?
And last point is that with the gynecological problem, when we started the prodrome, what were the earlier symptoms? And along with this gynec problems, is there any other female reproductive organ involved? For example, if it is a breast involvement with the uterus, or if it is a kind of urinary involvement with the uterus. So it's a concomitant. Always try to understand with the female problem what is the another sphere of action that is involved. This is how we can analyze it. So in the history, these points are to be go on into details. You have to go in details in this history. Okay. So if you are trying to deal with the gynec cases, the most interesting is that we must
प्लीज होल्ड ऑन गाइस, फिर से मैम का एब्रप्टली निकल गए। प्लीज होल्ड ऑन, और हम लोग ट्राई कर रहे हैं शेयर स्क्रीन करने के लिए। ऐसे ही शेयर स्क्रीन आएगा क्योंकि थोड़ा प्रॉब्लम शो कर रहा है, सो दैट्स व्हाई प्लीज होल्ड ऑन। Yes, ma'am. You are now live, ma'am. Yeah, okay, ma'am. You can continue, ma'am.
hello, hello,
You can continue, ma'am.
hello. Yeah. Yes. I'm very sorry for the interruption. I'm trying to understand, is there any reason behind this? I'm a little superstitious actually. So, anyways, so yeah. So the second thing that is very important when you're dealing with gynec cases, try to see that you study small remedies, because these remedies are really gonna help you. So knowing the polycrest pictures like Fistula, your Netromor, your Cali, your Calcaria is good enough. But knowledge of small remedies, if you have small remedies which has a main sphere of action on the female genitalia, then your gynec practice and the gynec cases are going to be little easier for you, especially because they come up with a lot of acutes like menorrhagias or metrorrhagias or dysmenorrheas. This is the time where maybe a small indicated remedy could really help to get the faith of the patient. So if somebody is bleeding profusely and if your medicine could really stop it, and if they develop the faith in you, they'll be with you for a long time. So how do you tackle the acute emergencies or the acute pains in gynec problem is important, and that is why small remedy study is important. This is one thing I would like to tell. Second most important thing is use of sarcodes, because that is what I have seen working with the doctors, that in this current generation, when there's a lot of hormonal problems happening, any out of 10, one person at least has PCOD. When this kind of complaints are becoming very common, when there's a lot of hormones which they are taking already, in our system, we could use the sarcodes which come to help when dealing with gynecological problems. So study your sarcodes well, because I have kind of used them a lot in my practice, and not maybe always as a main remedy, but with your constitutional remedy, they always make your path towards the cure faster, easier. Okay. So yes, so I had couple of cases to share with you. So I'll do one case here first. Vibha, will the this thing transmission stop once we finish 60 minutes? Hello?
We can continue, ma'am, no problem.
Yes.
We can continue,
Will
ma'am, no problem.
the transmission will not stop once we finish 60 minutes, right?
No, 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 ma'am. It's not going to stop. We can continue. Yeah.
Okay. Okay. So let's start with the first case. Short cases, I just want you all to start analyzing and seeing things differently. Okay, this is an effort. So, case of a 40-year lady, she has two children, and now she comes with profuse menses, and she has been bleeding for last almost 1.5 months. And the thing is, all the allopathy she's trying, and there's nothing helping her, and it's just like gushing flow that is happening. She's completely anemic. We had to actually give her iron infusion twice during the course of treatment. The hemoglobin dropped down to 9 and 8, so lot of menorrhagia, and which was painless. And yeah, that's it. Lot of weakness, lot of anemia, and only one thing she said, that she was very tired along that time, and it was a very bright blood, very bright flow of blood, and she was a little breathless, being anemic that time. And at the time, she did not like warm food. She preferred cold drinks. So this was the change state, and there was nothing very specific. The pathology had become so stronger that patient's characteristics had gone down. Okay, so you will get cases like this where there will be a lot of problem because of menorrhagias and metrorrhagias, and this is again a challenge to us. But we could help them in such cases. So I'll just tell you this interesting remedy. So because the bleeding is bright red and gushing with anemia and desire for cold drinks, so we had already given phosphorus, we have already given sabina, we have already given china. So all the remedies are exhausted, which is kind of indicated. And now the problem is even the allopathy is not helping. So very interestingly, what I specified it, understanding the small remedies in your practice. Really, if you want to help gynec cases, study this small remedy. So this remedy, very interesting remedy called Xenosia asoka, which is a very famous remedy in Ayurveda for gynec problems. What is the homeopathic indication of Xenosia asoka? Okay, so Xenosia asoka 3x was given to the patient. I myself prepared 3x from the mother tincture. We did not have expotency. So this is Genosia asoka has a very big sphere of action, from complete amenorrhea to complete lot of bleeding, menorrhagias, metrorrhagias. So it's kind of whole, any kind of gynecological problem you name, and Genosia could be indicated for the pathology, provided the characteristics are covered. And what is interesting about the pathology is that small remedies always compare with the big remedies, so you remember. So genosia, the pathology will be like a phosphorus. So they will come with hemorrhages. They have strong aversion towards the warm food or drinks. Okay. So and burning also like phosphorus. So you'll see a lot of burning, warm food aversion like phosphorus. And the mind typically is little hysterical like ignitia, where they can exaggerate their symptoms. You know, even if the complaint is less, they might be very hysterical and exaggerating their complaint. So ignitia like sentimental, emotional, hysterical mind. But two main concomitants, please remember for Zanosia asoka, if you want to use this remedy in practice, one is anemia, very strong anemia with your chronic problems, and the second is constipation along with this complaint. If this combination is present, that when your favorite phosphorus fails, when your favorite pulsatilla and ignitia fails, and when the patient is bleeding, then something which looks like phosphorus, which is better by cold, somebody who has mind like ignitia, hysterical, and the physicals of anemia and constipation, if they are strong, the remedy is genosia. A small remedy, but a very strong sphere of action on the female genitalia. Okay, so genosia asoka, also called saraka indica, kind of few doses, and that episode of dysmenorrhea completely stopped. It was just very magical to see that how homeopathic medicines, if indicated, and if you give on the right indications, could really dramatically help the patient. So this is one small remedy and how it took care of the uh, bleeding. So coming to small remedies, as I told you in this webinar, I won't be doing the polycrest remedies because we all know them. So I wanted to introduce small remedies to you which you could use in the practice. Another remedy which could look a lot like genosia, those which come with the hello, those who have lot of problems with the bleeding, there's another remedy which is Electris farinosa. Don't forget this remedy. Electris farinosa, if you read from any book, then you see the main sphere of action is on female genitalia. Everything is about a female genitalia. It's a small remedy and ailments from loss of fluids or hemorrhages. So classically, it is a remedy when the patient already comes to you very much exhausted, when there is lot of discharges, when there is lot of bleeding that is happening. Okay, and maybe you will not get very strong characteristic. What to do in this case? So a general indication like China, so when the patient is come to you who has bled, who's tired and exhausted. So it says that the books will always say about electrics is tired all the time, exhausted all the time. You will get a hint of sepia and China. So the formula for me for electrics is China plus sepia. So China, because there's lot of discharges happened, there is anemia, strong remedy for anemia. That's why I said compare with genosia because very strong concomitant of anemia with gynec problems. But at the same time, there is uh, this complete kind of lack of energy, tiredness, debility, just like sepia, draggy, tired. Okay, this remedy, Electris, has a very strong sphere of action on uterus, as I said, and just like sepia, it has history of abortions, it has history of prolapse or tendency for prolapses, and it has a history of strong dysmenorrhea. So again, I'm telling you, when patients will come to you, your sepia is failing, you are able to see sepia. You'll say, no, this is sepia. She's overtaxed, she's overworked, she's tired, she's bleeding and your CPI is not helping. You will say, yes, she has a history of abortion. You will say, yes, there is uterus prolapsing, but you are not able to control the hemorrhage. Like CPR, with lot of bleeding, with tiredness, with debility, the remedy is Electris farinosa. Remember this? So even when the patients come to you with lot of debility, you can give material dose also like mother tinctures also of this potency which will make them feel little comfortable, bring help to bring back the oxygen level in the blood by improving the hemoglobin. So electrics in low potencies will also work better if there are no indications, but if there are indications of history of abortion then you can surely use higher potencies. Okay, so we have done one case where there was history of lot of bleeding like phosphorus with anemia, but the remedy that was given was genosia because there was concomitant of like phosphorus and the mind like ignatia. And I compared another remedy to that, and that was electric sperinosa, which has again strong sphere of action on female, tendency for prolapse, tendency for abortion, and tired, draggy, anemic females. You will absolutely see CPR. Your CPR is not working. Think of electric. Think of electric. Okay. So let's go to the next case. So we have done two remedies here. We have learned two small remedies, Genosia electric. Let's go to the next case. Yeah, so this is a case of a female. She has very severe dysmenorrhea. Okay, so dysmenorrhea is so severe that even Before the period, she's scared. So 15 days before the period, she's worried that she's gonna get the menses in 15 days, because all the complaints kind of almost start for her a lot before the menses. So a week before the menses, the complaint starts building up. So something or the other, she'll come up with lot of weakness, lot of backaches, lot of leg pains, and then the menses is equally worse. Okay, classically, this patient had the symptom that she felt better in the open air. Whenever there's lot of bleeding and tiredness and this kind of dysmenorrhea, she wanted open air. So the couple of times I gave pulsatilla to her, and pulsatilla kind of took care of the acute dysmenorrhea, but was not helping exactly. Till I try to understand it, there were few interesting concomitants those were happening. That she used to get recurrent urination during the menses, frequent urination during the menses, and at the same time, even at the start of menses, she would get some kind of abdominal discomfort, maybe little flatulence, little bloatedness. So every time before the with the menses, she would get bloated abdomen. So with this characteristic symptom, she got a very interesting remedy. Anybody wants to guess? Vibha, would you be able to see if people suggest some remedies? Hello?
Excuse me, ma'am. Yes, ma'am.
Will you be able to suggest some remedies? Are there viewers who would like to suggest any remedy?
Due to the network issues, Vibha ma'am is coming now. Just please continue. Due to the network issues.
Okay. How many viewers are there right now? Hello? We have the transmission is going
Yes,
on, right?
16, ma'am.
Okay.
16.
The transmission is going on, right? Okay.
Yes, ma'am. Let's.
Okay, so this is a case where there is severe dysmenorrhea. Complaints start a week before the menses itself. Urination problem, frequent urination with the menses, and flatulence with the menses. And typically, the pain would kind of come from the back because she had a lot of backache. It would come to the uterine thigh. So from the back, it is not coming like straight from inside, but it's kind of coming around the waist and in front. So around the waist, in the uterus, and then in the thigh. So that was a characteristic pain. The remedy that patient got was viburnum. Viburnum. So what I want to tell you, viburnum is another very small remedy, a very strong sphere of action on female genitalia. If you know this remedy, you are gonna treat a lot of dysmenorrhea. It's gonna help a lot of females who are in pain. Classically, it might look like your menopause because the pains are gonna be extremely crampy. The whole genius of viburnum is cramps, and extremely painful cramps. So every time there's this crampy pain and patient is tossing and you are giving your Macfos and it is not helping, think there's another remedy for this terrible cramps, and that is viburnum. Provided the complaints start usually before the menses, classically before the menses, and once the flow starts, they're a little better with the flow. Okay, the concomitant for viburnum is most of them will have lot of leg ache, pain in the calf, which is before the menses. Pain in the calf before menses is kind of characteristic of viburnum. Remember that. Okay. So let's come to the and classic location is a left side. Yes, I forgot to tell you this patient had dysmenorrhea and typically she would get pain in the left lower pelvic region and she felt better in the open air. So this combination of better in open air open air, pain in the left side, flatulence during the menses, urination frequent during the menses, and complaints before the menses gives a good indication for viburnum. Okay. Next is we have another case here where it's a short case for you all, but to manage this was very difficult because this patient has fibroids. Young girl, she has fibroids. She has ovarian cyst, and she has been chronically suffering from dysmenorrhea. Very, 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 very bad dysmenorrhea that she actually tosses in pain, tosses and twists in pain, and no amount of painkillers help her. That is her situation. So she's applying hot water bath, she's pressing her abdomen, she's doing everything, but nothing kind of relieves her. That is the state. And she experiences this every month for years. Very, very bad case of dysmenorrhea. And what happened eventually is that, and again, lot of remedies were given to her, and how a very small remedy helped her. That's what I'm trying to tell you. Beauty of small remedies in gynec cases. So when she developed ovarian cyst, she classically developed a left-sided ovarian cyst. And during a, a period, that symptom she gave, that the pain would go down to her left leg. So the pain from the ovary would go down to the left leg with this kind of severe dysmenorrhea that there was nothing that would help her. Nothing absolutely. Based on this symptom, the remedy she got was xanthozylum. So xanthozylum is another small remedy, very strong sphere of action on gynec. You should think of. Classic modality of xanthozylum is that nothing helps. No, nothing helps with dysmenorrhea. It is not better in any position. Nothing you do will help the patient. So when there is strong dysmenorrhea pains which are flying, so from that particular place the pains are radiating, and classic for xanthozylum is a left-sided ovarian pain which goes down. But even the uterine pain could be coming up to the chest or down or to the other side. So they are radiating in nature, extremely neuralgic tendency. Then the remedy you should think of is xanthozylum. Okay. The only difference is the more the flow, the more the pain. In viburnum, I told you with that classic cramping MAC was like dysmenorrhea. Once the flow starts, the patient is little better. She's worse before the menses. Whereas in xanthozylum, with the flow, the complaints are more. She's worse as the flow increases. This you remember, that will help you to differentiate between viburnum and xanthozylum. Why am I doing it? Because both are left-sided. The first patient I told you was again left-sided, and xanthozylum is again left-sided neuralgic pain. So one is worse before the menses, one is more worse during the menses. Xanthozylum is more worse with the flow. The pains will be worse with the flow. Okay. And classically, if in viburnum the before menses the symptom was leg pain or the leg cramps before the menses. Cramps is the genius. Then in xanthozylum, mostly typically headaches will be the concomitant with the menstrual problem. That's what I'm saying. Which other system is associated with your gynae? Always see that. So if there's typically headache before the menses with this kind of severe neuralgic pains with no modalities, nothing relieves the patient, think of xanthozylum. Okay. Okay. So I'll come to another interesting case here. Um, I think yeah, I could do this case. So this is a case which I was already treating. So this is a case of a female. She has a history of migraines, very bad headaches, and skin problem, urticaria. She would get, and very bad urticaria. She would take this Atrax medicine every day for years, and the remedy that came for her was Netrum Moor, and she was much better with Netrum Moor. and the migraine, it helped in migraine. The skin cleared up until she developed the menopause. So now her menses were irregular, and she skipped her menses for 3 4 months, and now she was getting a lot of hot flushing. Okay, and because Natramur has already helped her, I gave Natramur again, and it did not help it. So right now, what was happening is that she said there was just hot flushes everywhere and every part of her body. It's not localized, generalized everywhere in the palms, in the soles, in the earlobes, everywhere there was hot flushes. And she says with this hot flushes, since that she has not got the menses, what she developed is kind of prickly heat, a kind of rash. She would develop itching followed by red dots, like so typically when you get during the summers, right? Prickly heat like eruptions that she developed. So that was it. And she was worse in the warm room or warm weather, and she preferred cold AC. So what to do? There were no other characteristics. There is no other strong mental characteristic. There is no other general characteristic. So what to do? So just because it is menopause and better by heat, should we give uric acid or should we think of something else? So because there was no clear picture available, there was no strong change in the mentals. I thought let us only focus on the remedies which are specific for menopause, where which has a very strong sphere of action, or that I say phases of life. Menopause is the main focus of that remedy, and which should have along with this a prickly heat kind of rash as a concomitant with the amenorrhea during the climacterics and with that hot flushes. And in the reference work, when I put this prickly heat and menopause, one of the remedies which came up strongly and which I want to tell you. Any guesses? I don't know. I'll tell you the remedy which I gave for this patient was Morgan Pure. So it's a bowel no sore. Okay, Morgan Pure remedy was given. So Morgan Pure is kind of specific for, I am not saying it is the specific, but it is kind of specific for menopausal flushing. Remember this remedy. If no remedy helps, maybe Morgan Pure will help you. So this is a kind of very strong sphere of action on female genitalia, classically causing hot flushes in the pruing with sulfur-like skin symptoms. So if it is more of lipo-like stomach problem, then it is Morgan Gartner. If it is more skin symptoms, then it is Morgan Pure. Okay, so that is the difference. And pure, in pure, the classic prickly heat kind of eruptions was very strong. If you even study LN, you'll be surprised to see how many skin symptoms are under Morgan Pure. A big very big sphere of action typically on skin. So climacteric flushing, hot flushing, classic of Morgan Pure with sulfur like skin symptoms, which was worse by heat and better by cold. So the remedy she got was Morgan Pure, which kind of helped her much in her menopausal flushing. Naturally, it's a menopause, the menses are going there. You can't maybe probably bring change everything, but she's much better in her suffering. Even now in last 1 year she has bled 2 3 times. Still she's going undergoing it, but there's no suffering like before, like the hot flushes and everything has reduced a lot. Okay, so as I told you, this small things like the small remedies, the no source, the sarcos you should think of. And finally, I would like to end the session with another very interesting remedy, which I believe could be used for very common complaints which the females come up with, and that is premenstrual problem. Many a times there are women who suffer a lot because of premenstrual syndrome, whether either they will develop migraines before menses, they'll develop severe breast pain before menses. Some people develop a lot of constipation, lot of water retention, putting on weight, bloatedness, So when there is lot of complaints that are premenstrual, try to understand this lady has to undergo these problems every month, and nothing much could be done about it because the allopath will either put her on hormones which she doesn't want to take and she cannot help it. So for those cases, okay, premenstrual aggravation, one of the remedies which you should remember and use in your practice if indicated is polyclinic. Remember this remedy, this could be your savior. There was a case which I had. The chief complaint itself was premenstrual aggravation, which was very surprising for me because she would get extremely angry, agitated, will start fighting, breaking things, and it was a big issue. She had other problems like water retention and irritability. Everything was before menses. And with the other history and other symptoms, which is a classic of polycillinum, it's just like carcinosin, lot of domination. So whenever you see this expression of the female is suppressed, when she is not able to, express herself, her views, and she has been dominated for a long time, which will be a classic situation in Indian families. That is why I'm saying folliculum could be a very good remedy. So if you when you have a history like this, when there's a lot of suppression, she has suppressed her views, and now when every aggravation is before the menses, then one of the remedies which you should remember is folliculum. Okay, it could look very much like Tethysagria also because it has ailments from suppressed anger. So a lot of anger which is suppressed eventually leading to PMS symptoms. The effect goes to your uterus. In Tethysagria, once you suppress the anger, the effects goes to your nerves. The person throws up a convulsion. Here, if there is constant bottled up emotions, constant suppression of the anger, the effect goes on the uterus. That is a characteristic of it. Folliculinum. Uh, so the indications could be consider all kind of pathologies when there is lack of estrogen in the body. So, for example, a lot of water retention, alopecias, tendency to put on weight. So anything they eat quickly, they put on weight, or lot of weight gain before menses. These are some very good indications. So when you have a general picture of lack of estrogen, but not any specific symptoms, but a strong premenstrual aggravation with this kind of domination and suppressed anger. And when your uh, constitutional remedy fails, think of folliculinum as a SAR code that we could use in treatment. Okay. They can also come up with eating disorders, bulimia, tendency to eat a lot. They could also have history of sexual abuse, like sepia, like aristolochia. Okay, so so that's what I wanted to tell you. When you are dealing with the gynec cases, think of small remedies. We did Genosea asoka, we did Electris farinosa, just like Genosea. A lot of tired, draggy females who are exhausted after the hemorrhage. We did some painful remedies like viburnum, the left-sided, like MacFoss like cramps. We did xanthosylum, no position relieves the patient, and left-sided neuralgias. Again, small remedies, study them in detail. We did a bowel no sore, that is more than pure, which is sulfur-like, but during the menopausal flushing, hot flushes, almost kind of specific when nothing works. Think of that. And then we have also learned Sarcode today, which could be very, very interesting for Indian people, for the ladies who are suppressed, who are dominated, who have suppressed their anger, and they come up with a lot of premenstrual aggravation, weight gain, alopecia, bulimia, history of sexual abuse, and there's a lot of suppression. And classic, even religious suppression is very strong in polyculinum. Think of a remedy like that. So when we did today gynec topic, the whole focus was to tell you that your polycrest will surely work in the cases, but when there's a block, when they don't help, or even when you have a polycrest in your mind, but if the acutes or the pains or the menses is too much, study with small remedies. Small remedies, make a small drug picture, compare them to the big remedies, like make small formula, like how genosea, I remember, is a phosphorus ignatia combination, right? How electris is China and sepia combination. Like make your small formulae which will help you to think of that remedy when that polycrest fails. Okay. Yeah, I think I will stop here. I'm sorry for all the interruption that we had. And I hope whoever attended, you could learn a little bit from the session today. If there are any questions, you could write to me at amruta.hede@gmail.com. Yeah, Dr.
Okay,
Vibha,
so
what you have to say?
yeah, it was a really very good session, ma'am. What are you telling about? What you enlightened about the small remedies, that is very important to understand actually, and whatever technical things we faced in our all this remedial knowledge and the remedial differentiation cover it up already. So really the explanations about the cases, about the remedy differentiation is very very good really. So thank you so much for explaining all the small remedies, all the rare remedies very nicely, especially for the menstrual problems, because this is something which we can every doctor can attend this cases in their OPD day to day practice. So it was very useful in clinical practice whatever you taught here. So thank you so much for all this awareness of your experience and knowledge of your on this platform today. So we are very glad to have you here, and I know your so many diseases are going there and you're too much busy nowadays. Instead of that, you accept my invitation for this webinar. So thank you so much for that.
Thank you very much. Thank you very much. See you guys. If there's any question, you can write to Vibha, you can write to me. We'll try to help you. Okay? Thank you. Okay,
Okay,
somebody is
so
asking. You can
Dr.
ask questions. What is the question? Ma'am, why constitutional remedy fails in this type of cases? I'm not saying constitutional remedy will fail in gynae cases. No. What I mean to say is that because the cases that come to you, especially the gynae cases, they will come up, or any case that comes to a homeopath will be somebody who has already taken lot of allopathy. They always come to us when there is a dead end, when they have given up. So these cases will always have lot of blocks. There will be pathology which will be too strong, or there will be lot of, especially if it's gynec case, lot of hormones taken. So in these cases, it will be good to know small remedies, SAR code. So if at all you feel a block, I personally have felt a lot of blocks. I don't know, but I felt that whenever, even though my indicated remedy was helping, somewhere the tissue is not still there. You have given your pulsatilla, but the fibroid is not going at all. Then think of remedies which are like pulsatilla, a small remedy which has a sphere of action. So maybe some other tinctures of those remedy will help to tackle those problems. I'm not saying constitutional won't work, but I'm saying if at all there is a block, think of the no source. Medorinum is also very interesting no source, which is indicated in majority of the cases. And when the medorinum fails, think of folliculum.
Yeah, yeah, yeah.
Okay.
Hope the
Any other
doctor got
question?
this. Dr. Lavanya, if any other question there, just pop on screen. So this is the suggestion of remedy only. Any other question is there?
Okay. Cool.
Okay.
No, ma'am. That's all, ma'am.
I don't know how many could attend, but whoever was there, I tried my best to teach.
Always, you are always best
So yeah.
whenever you
Anyways,
teach or. Okay, so on this
so
note, we are
anyways, good
going to
luck
end
to
your.
all of you. any problem, you can approach us. Okay. See you for now. Good night. Goodbye.
So on this note,
As somebody is asking potencies, wait, what potencies? Again, if you feel your remedy is just generally indicated and there are no strong indication like a pathological drainage remedy you're giving, then think of low potency. Like I said, if somebody has bled a lot, is tired, exhausted, and come to you with this history of prolapse, then maybe the same electrics you can give in mother tinctures for them to feel that vitality. But if you have the indications of other indications of electrics, you can give high potency. So the more characteristic symptoms are present, you will go for higher potency. The less they are, you can use them drainage remedies.
okay, thank you, ma'am. So on this note, we are going to stop our today's session. So viewers, if you want to get your e-certificate of this webinar, link is in the description. Fill the form and get your e-certificate. As you all know, our Homeo Vision Revolutionary 11 days webinar series is still going till 10th of the November. So every day at 8:30 p.m. we are here. So tomorrow, Dr. Shailen Singh is to yeah, Dr. Lavanya. Okay, so tomorrow with us, Dr. Shailendra Singh sir will be there. So join us and learn from different legendary homeopaths here on the Aisha's platform. Just if you like the videos and the topics and the speakers talk, just like, share, and subscribe Aisha's YouTube channel. Thank you so much for today. Good night.